Hi everyone, and welcome to our presentation on breast cancer in women by the MVBT Girl Scout Troop 60736. We are doing this presentation to earn a Women's Health Badge and because it's Breast Cancer Awareness Month in October, which is why we chose this as our project. Breast Cancer Awareness Month is also referred to as the National Breast Cancer Awareness Month, and it is an annual international health campaign organized by major breast cancer charities. Every October, the campaign raises awareness of the disease and funds for research into its cause, prevention, diagnosis, treatment, and cure.
So this type of cancer is like any other cancer. Typically there is an abnormal or old cell, and when there is an abnormal or old cell, they die off. However, in some cases it doesn't, causing the unhealthy cell to duplicate itself and soon overpower the healthy cells. Due to its name, this particular cancer is located in the chest.
Breast cancer is the most commonly found cancer in the world, with 2.3 million women diagnosed with cancer in just 2020 alone. In America, 1 in 8 women have breast cancer over the course of their lives. In 2020, around 685,000 women died from breast cancer. Over 3.8 million women in America have had some type of history with breast cancer as of 2021. Though the risk of breast cancer for Asian women is low, living in America and adopting an American lifestyle can increase the risk of developing the cancer. There are 5 stages of breast cancer, starting from stage 0. In stage 0, the cancer is limited to certain regions of breast tissue and is non-invasive, meaning that it has not spread to other parts of the body. In stage 1, the tumor has become invasive but has not yet reached the lymph nodes. Stage 2 is when the tumor is found in 1 to 3 lymph nodes or is larger than 20 millimeters. In stage 3, the tumor is larger than 20 millimeters and in the lymph nodes, or the tumor is larger than 50 millimeters. In stage 5, the tumor has spread to other organs, such as lungs, and is any size. The survival rate of breast cancer decreases with each stage. For stage 0 and stage 1, the survival rate is nearly 100%. However, in stage 2, it drops to 93%, and in stage 3, it decreases to 72%. Stage 4 has the lowest rate of survival at 22%.
Even though it's hard to tell if you have breast cancer or not, here are some more noticeable symptoms of breast cancer. A lump in the breast or thickening that feels different from the surrounding tissue, bloody discharge from the nipple, changes in the shape or texture of the nipple or breast, changes to the skin, peeling, scaling, crusting, or flaking of the pigmented area of skin.
Breast cancer can have effects on your physical and mental well-being. First, for physical, there may be change in body image, fatigue pain, lowered bone density, changes in weight, hair loss, the side effect of early menopause, which is irregular periods, absence of periods, hot flashes, night sweats, vaginal dryness, moodiness, and mental fogginess. Next, for mental well-being, there is depression, anxiety, uncertainty, fear, loneliness, and body image issues. There are 3 breast cancer treatments, which are chemotherapy, radiation therapy, and surgery. The first type of treatment is chemotherapy, which is a treatment where you use drugs to target and destroy breast cancer cells. The drugs are usually injected directly into a vein through a needle or taken by mouth pills. The next type of treatment is radiation therapy. Radiation therapy uses high-energy X-rays, protons, or other particles to kill cancer cells. The X-rays or particles are painless and invisible. The last type of treatment is surgery. There are 2 types of surgery, mastectomy and breast-conserving surgery. Mastectomy is when the entire breast is removed, including all of the breast tissues and sometimes the other nearby tissues. While breast-conserving surgery is only the part of the breast containing the cancer is removed. The goal is to remove the cancer as well as some surrounding normal tissues. An example of breast-conserving surgery is lumpectomy.
Breast cancer can cause other health issues as well. If the cancer were to spread to other places of the body, it could lead to cancerous tumors in the brain, bones, liver, lungs, and other regions of the body. Likewise, although the cancer itself can't cause high blood pressure, diabetes, or kidney failure, the treatment for it can. Many breast cancer survivors have a higher chance at developing diabetes than the average woman.
Some ways to reduce the risk of breast cancer in women is being physically active. Women who are physically active for at least 30 minutes a day have a lower risk of breast cancer. It is thought that physical activity regulates hormones, including estrogen and insulin, which can fuel breast cancer growth and help keep the immune system healthier. Eat your fruits and vegetables. A healthy diet can help lower the risk of breast cancer. Try to eat lots of fruits and vegetables. Plant foods are rich sources of fiber, antioxidants, and phytochemicals, which have been shown to decrease the risk of cancer and protect the body from chronic diseases such as diabetes and heart disease. Avoid too much alcohol. Keep alcohol at a moderate levels or lower. While moderate drinking can be good for the heart in older adults, even low levels of intake can increase the risk of breast cancer. If you don't drink, don't feel the need to start. If you do drink moderately, there are likely no reasons to stop, but if you drink more, you should cut down or quit. Drinking even small amounts of alcohol is linked to an increased risk of breast cancer in women. Alcohol can raise estrogen levels in the body, which may explain some of the increased risk. Don't smoke. Smokers and non-smokers alike know how unhealthy smoking is. Smoking lowers the quality of life and increases the risk of heart disease, stroke, and at least 15 cancers, including breast cancer. Cigarette smoke contains toxins, including cancer-causing chemicals. Found out your family history. Women with strong family history of cancer can take special steps to protect themselves, so it's important for women to know their family history. You may be at high risk of breast cancer if you have a mother or sister who developed breast cancer, or if you have multiple family members who have developed cancer. A doctor or genetic counselor can help you understand your family history of disease. About 10% of breast cancers are related to inheritance of damaged genes, including the breast cancer genes BRCA. And don't forget screenings. Self-exams and mammograms are the most common ways to detect breast cancer in early stages. Studies show that breast cancer screenings of mammography saves lives. It doesn't help prevent cancer, but it helps detect cancer early when it's most treatable. For most women, regular mammograms can begin at age 40. Specific recommendations vary by age and risk. Please remember that these are not surefire ways to prevent cancer. These are just tips to reduce one's risk. There's always chances that one can develop cancer. mammograms. For many women, mammograms are the best way to find breast cancer early, when it's easier to treat and before it's big enough to feel or cause symptoms. Having regular mammograms can lower the risk of dying from breast cancer.
So there are many support groups that exist, but here are a few that I found. The American Cancer Society provides a wide variety of support for all types of cancer. These services include finding lodging, providing transportation, and a 24/7 hotline. A few other services they provide are listed. The next support group is breastcancer.org. They specialize in supporting people with breast cancer. They also provide free educational material. They have different types of support groups, which can be led by a professional or a cancer survivor. The National Breast Cancer Foundation Incorporated is another support group that specializes in breast cancer. They sponsor the National Mammography Program, which provides free breast cancer screening and diagnostic testing to those who are underinsured, uninsured, or have low income. They also have the Patient Navigator Program, which helps educate people about breast cancer, helps guide people who are going through treatment, supports cancer survivors, and provides financial aid. The last support group I researched was Bay Area Cancer Connections. They are locally based in San Mateo. They have a personalized support group which is free of charge, which includes buddy pairing, counseling, medical research, wig boutiques, and more. Additionally, every month they have over 50 events for those going through or who have gone through cancer, and those who know people going through treatment. They also have a virtual resource center to give support and help to those during COVID. The number for their help hotline is 650-326-6686.
We would like to thank the Mountain View Buddhist Temple and Sangha and cardiologist Dr. Girja Viru for reviewing the accuracy of the slides. Please pick up a pink ribbon for breast cancer awareness at the back table. Thank you.